Okay, so we have Christine here, and she is gonna discuss her experience with cancer, how she dealt with the news of having cancer, what she did, and how she ended up coming to us. So let's see. She can tell the story anyway. It's her life, so I'll leave it open to her how she wants to discuss it. Go ahead.
Okay. I was diagnosed with invasive lobular cancer in August of 2009. And I immediately started researching and looking on the internet for treatment options. And the doctor said I went to recommended a mastectomy, and they were planning to do radiation therapy, and they wanted to check out my gene status. And the more information that I collected about those treatments, the less I wanted those treatments. So I started looking for something else. And I received an email from a friend of mine who was a dentist, who said that if his wife had breast cancer, this was a treatment that he would look for, and it was LIESH Inc. So by this time, I had started taking tamoxifen, but I got on the phone with Dr. Carpenter in December and chatted with her about coming to Oklahoma, and then I started making arrangements to do that. And so in March of 2010, I came to Oklahoma, and I had my treatment, and it took, she had scheduled me for 5 days, and I didn't know that I actually had a cousin who lived in Broken Arrow, so that was amazing, and they were very supportive of my choices, and so Dr. Carpenter had some recommendations for things for me to take after the treatment. And so I came home, and I didn't have to miss any work at all. I felt good. And so basically I've just been waiting to have confirmation that the cancer was gone. And that happened. I just had a recent sonogram in September, and this is 2011, of course. And the tumor that they did the biopsy on was gone. So.
Gone, poof. And what did they say to that?
Well, they can't say anything. And in fact, the sonographer, I was waiting in the waiting room. She was going to give me a disc of the sonogram results, and she called me back in there. She said, no, I need to check something else. So I went back in the room, and she said, I'm looking at your old sonogram films, and I just don't see anything at I think it was the 9 o'clock position. She said, I just don't see anything there. And I looked at her, and I said, that's very good news. And, of course, she couldn't say anything because she's not the doctor. I think that was very good news for me. So,
well, it would have been for anybody. I'm sure it was not very good news for the member of the establishment, because I'm sure they had on record that you didn't do any of the standard, right?
They basically gave me no support. When I even suggested that I was thinking about photodynamic therapy, they acted like I was very ignorant and that I didn't know how to make good decisions. And then even after I had the treatment, I did try to follow up with oncologist. And one day she was in her office. She said, why are you here? And I thought, to myself, that's a very good question. I don't need them anymore. So I just haven't been back.
So what did she say? Why are you here? Because you didn't
I wasn't following any of their treatments. I had stopped taking the tamoxifen.
Good.
I didn't want to take any more MRIs because, that exposes you to more X-rays, which X-rays can cause
the MRI
cancer.
exposes. Well, the MRI, that's why they say it's safe. The MRI exposes you to very high magnetic fields, which are not very good for you either. So, that's what the MRI does.
I meant to say mammogram. They wanted me to have more mammograms, which is the X-ray. So I'm sorry, I said that wrong. But
okay.
So I just haven't been back since she asked me that. And actually one time they sent orders for the wrong breast to be looked at. So in very big institutions, things like that happen. But it's good. It's good that I was alert to catch that, because you certainly don't want to have to go through something twice when it's the wrong side to begin with.
Oh gosh. Yeah, and these are the expert, right?
Yes, these were very well known hospital, and like I said, things like that happen. That's okay. But
it's not. It's like saying. Well, I've heard of cases that they removed the wrong limb or the wrong part. I've heard of that.
Well, this was just for a test. This was just for the sonogram, but the doctor did write it down wrong. And but I since then I am taking some mistletoe injections.
What are you doing now?
That's one of the naturalist doctor that I'm seeing recommended that.
Do you know what that is?
Really,
but you know what that is? Natural chemo.
So?
It is Cador.
Oh, okay.
That's what the... you don't want to take that. It's chemo.
Okay.
Yeah. I know. Even the alternatives. See, the problem is that even the alternatives are not on the bus with us. We are outside everything because nobody can accept.
You don't have a bus,
right? I have an airplane. No,
that's your whole thing is that you're not on the bus. Everybody else.
I'm not on theirs. No, I'm on my spaceship. It's all a different world. Hey, I'm an alien, okay? But anyway, the mentality is that it's the cancer systemic. It isn't. It's not. It's not systemic at all. Mm-hmm. So, and you don't want to poison your system without any need for it. You're doing fine. And I know Iscador is not, obviously is not that damaging, but if the damage happens, it's too late to fix it when it occurs. So you want to stay away. You don't need anything. But that's what happens even when you go, because you can't get any support from standard medicine, so some people go to alternative. Oh, geez, we got another day. Okay, we'll be back.
Maybe Ray again.
Yeah.
Free speech guaranteed. You're listening to the Orion Talk Radio Network.
Okay.
That came over the air.
What, the Barracuda? It did?
Yeah.
Okay.
It did, yeah, obviously. Hi, JJ. How you doing, buddy?
Okay, are we back or what? Are we?
Oh, we're live.
Oh, okay. Anyway, so we were just discussing about what's happening on the chat board, and doesn't look like anything yet, but it's only yet, okay? All right. Well, my point is, patient gets scared, and then they do some additional things. Fortunately, it's not something that really does that much damage, not as much as tamoxifen would have done, but it is something that is not necessary, and it should be avoided. But other than that,
I was very glad to come off the tamoxifen after after I talked with you in December, and then I came off it before I saw you in March. And that was a very good day also, tamoxifen. And I don't get along very well. So So I was glad to be off of that.
That stuff is bad for everybody. Yeah. Mm-hmm. Go ahead. What? Like you said, what?
Yep. Just I felt good, and I think whenever anybody has to face the thought of having cancer, the first thing is, okay, when am I going to die? And I think that, it's kind of a fearful thing. But once I kind of felt like once I had found the photodynamic therapy and a way to treat it that I felt like was much more healthy for my body, that gave me a good sense of peace. And so I was able to focus more on getting healthy and not, oh dear, what's going to happen, to my family and that sort of thing. And the other comment that I'd like to make about cancer, I don't think people realize is this treatment is reasonably priced, in my opinion, compared to the traditional treatments. And traditional treatments can bankrupt a family. And I think that's another side of cancer that a lot of people don't consider. Again, I'm very thankful to be on the other side, and thankful for Dr. Carpenter's treatment. And
we've talked about there's been some articles we talked about rifts going in between families over cancer treatment.
Yeah, but she didn't.
It can be extremely expensive. I didn't go that route, and that's what I'm saying. It can be overwhelming to a family to continue with chemo and radiation, and I'm glad I didn't do that.
And
in fact, I remember telling my husband, I said, I'm not going to do that. I'm not going to bankrupt my family just so, I can live 2 more weeks. I'm doing that.
Well, can I ask one thing just from the ignorant perspective? Because if I ain't nothing else, I am ignorant. But did you experience that immune response after the treatment? Because I'm always hearing about that immune response, because that has been the subject of so much what do I want to say, slander blogging and everything else. It was a phase of time where things actually swelled up.
You know what? I did not. Really? I don't know whether it's because my particular body system, but it did not get red. It did not swell. It did not do any of those things. I was,
wow.
Like I said, I felt good. I was able to work. I didn't have that.
I thought that maybe once you sent me an email saying that you were a bit concerned. I thought that was only once. I seem to remember. I don't know.
There was some. Yeah. There was, it was uncomfortable a little bit, but I don't remember it. I don't remember it getting red and swelling. I don't.
Okay. Just was uncomfortable. Okay. But,
I just had to ask, though, because I've read so many of these stories that people are using to attack Dr. Carpenter, and they talk about that phase of time where things swell and get inflammation.
Yeah, but that's also because I say very clearly, do not take any immune system boosters. They don't listen and do it, and then they have all this explosion of reaction. That's because they're boosting the immune system, which is already boosted and working on removing the dead tissue. You increase the situation, and then you have a mess there. But if you follow our guidelines, then it's not that big of a deal. See? She didn't have a problem. And in her case, she didn't take immune booster even before. So, see? That's why she didn't have all that reaction. And that happens to others. It's just a question. You really shouldn't straddle the fence. You either do one thing or you do another. Not try to combine and make a mess out of it. And that's the real problem. If people leave it alone, I've heard of a lot of cases that don't have a reaction. Yeah? What?
Yeah, I think, the most the thing that caused me the most issue was, of course, I went back to the oncologist, but, and again, they just, in the end, were not supportive. So, again, once I made that decision not to go back to them, then, I was happy. Because of course, they want you to do the, mammogram, and they look at you cross-eyed when you say no, and they don't even want to consider that there's another solution. So
there is a real solution.
That was the most shocking thing to me. Yeah.
Yeah, because what they do is not a solution. Getting, it just has to go back and more treatment, getting maimed, getting poisoned. What kind of solution is that? It just unbelievable. But that's what they want to do. They don't want to hear, even for the testing, they don't want to hear anything different. You can't. And my question is, why would they want to do a mammogram? They already know that you had cancer. They already know there is a lump there. Why would they want to do a mammogram? What for? I don't understand that.
That's a good question.
Radiate it some
I
more.
didn't understand it either.
Yeah.
Yeah.
Just
make it grow.
And if you don't have surgery, the lump is obviously still there. So the mammogram will see there is something there. But then all the other tests will tell you there is nothing going on. So what's the point? And just make you miserable, because then you worry all the time, and that's not healthy. So, but, and that's what I wanted people to understand. If you follow a certain route, stick to it, you'll be fine. The messes happen if you don't stick to it. See, but you did, and you're...
Well, I think, American society is instant, and that this, I did wait a year and a half. A lot of people are not willing to do that.
Well, yeah, but look what you do when you get surgery and then you get chemo and radiation, then you got to go back for more and go back for more. That's not instant either. And then you're really sick. So I don't understand the mentality. They thinking...
Well, the other thing is, I wanted to use with my left arm.
Right.
I wanted to be able to use so I don't have any of those complications either. So I'm very excited and encouraged. Yep.
Well, that's because you have all your lymph nodes. Nobody removed them.
That's right. Exactly.
I know. It's really great to hear people when they say, I'm fine, I don't have any problem, nothing happened to me, and I'm doing great. And the main point is you're still a productive citizen. You work. See?
Yes.
So you have a normal...
And I even found another job in the middle of everything also. That's another concern once you're diagnosed with cancer is, being able to find work. And and I have been able to do that. So
that's really neat. It really is.
Yep.
See, because nobody has to, because if they hear the word cancer or you're on cancer treatment, they know you have to take a lot of time off, so they won't hire those people. See?
Mm-hmm.
They don't hire those. That's great. I consider this a really happy story.
Absolutely.
I'm sure you do too.
I do, and I tell my friends and coworkers and people who are interested in alternatives about you. So I do.
Yeah, the problem is that a lot of people listen to their oncologist, their GP, and their oncologist, and they end up in a trap. That's the bad part about it. See?
That's true.
But anyway, so keep on fighting the oncologist. Stay away from them. And just have a good life.
I'm not planning on going back. No.
Oh, you don't have to? Okay. Oh, we got another thing. This is Van Halen. Okay, we're back from the break, and Christine is still with us. And what I wanted to add was, what she told me is that she had her family supporting her choice. So she had her family behind her. Right? Mm-hmm. Correct?
More fortunate than some.
Yeah. What?
Well, like I said, I've heard about a lot of splits up and rifts going between families over what kind of treatment channels they want to use.
Well, it can be difficult, but Dr. Carpenter has a wonderful website. It gives you very good information. There's a video clip that you can watch and look at the procedure that she does. She gives you a scientific basis for making this good decision. So, all of that convinced my family that it was a good treatment option for me.
Yeah, and it's kind of strange that a lot of people, they don't want to look at it, they don't want to hear anything. You have to go because the expert tell you that that's what you need. Well, look at the statistics, they're not very good. And I have had patients that went back home after the treatment. They were feeling great, and the family was saying, you're delusional. You still have cancer. You're not doing well. You just think you're doing well. How can you do that?
And not to mention that website. I tell you what, Dog Boy has taken more ridicule over that website. Oh, boy.
Well, it was great for me. I mean, that's, of course, the first thing that I looked at when I got the information from my friend. And, the more that I did research about it, I mean, it's a 100-year-old procedure. There are other tweaks to it besides Dr. Carpenter's, but anyway, hers was the one that I felt the most comfortable with, and it gave me the most information. It was very specific to what I needed. So yeah, I was very pleased.
And we are all pleased that you're doing great and you're back to have a normal life. At least you don't spend your life worrying about cancer. And that's the thing. It's gone. That's it. And what's left is going away. And you don't have to worry about anything. And you can go on with your life. And you haven't been poisoned. You haven't been maimed. It's just all you in one piece. And that's, what else it could be there? What else can you ask for? This is it, But anyway, thank you.
I'm sorry, I didn't mean to interrupt, but I find it particularly interesting that you didn't experience the immune response, because I've heard so many other people talking about it, and so that's just icing on the cake right there.
But
I kept looking for it, and I did call just to make sure that things were okay, because it is a. But Dr. Carpenter's been very responsive, and she's answered all my questions, and I couldn't be happier.
And neither can I. I'm really glad too that you're doing great. And I think that from what I have seen, a lot of patients, even if they take an immune booster before they came to us, that has the same effect for some reason. And then they have this explosive immune response. But that's all it is. See, so that's just, and also depends on where the tumor is, because if it's on your neck or in your mouth, then the area gets really tender and sore. And so that's a different thing too. So, but I am really glad that you're doing great and you didn't go through any of those headaches and you didn't have the opposition of your family. That's very important. So it is great. But see what happened? It can end up in a really very, very happy story if you do follow the right path. That's all there is to it.
That's right.
Oh, and that's all you needed to do. Pretty simple, in my opinion. Couldn't be simpler, really. 5 days and you're done. What else is there?
I know. That is the amazing thing. So
they can't do that in Mexico, can they?
No, in Mexico.
Not in 5 days.
And they can do anything in any way anyway, other than mess up your. And you ate anything you wanted. It's not that you had to control your diet. That's the
right.
other thing. So
right. My stomach wasn't the problem. In fact, I still really like chocolate, so I'm glad you had chocolate in your office.
Oh, no! You ate chocolate! Oh, no.
I know.
You can eat anything you want to. And it's, that's terrible. That's not a doctor. A doctor doesn't say that. Yeah. The medicine thing is forbid you to do something you really like to do or eat something you really like to eat. That's just has been the standard of medicine from the beginning of time. We used to tease it when I was still in Europe. So, and instead I say, okay, now the cancer is dead. You want chocolate, you want ice cream, you want a cheesecake, go right ahead. It makes you feel good and you feel happy. See? And it won't make any difference because it's dead. Not that it does that much of a difference even when it's not dead, because it helps it grow a little bit, but it just doesn't make that big of a difference. Other things that they do, like biopsy, makes it a worse case, not the chocolate. Mm-hmm. But anyway, okay.
Don't forget meat.
All right.
You can't eat meat either.
Oh, yeah, right. And you're never going to heal if you don't eat meat because you can't rebuild tissue, so that's ridiculous. But anyway, thanks, Christina. I really appreciate your coming here. And at least for people that listen, they can find out what is the full experience and what really happens, which is what I think everybody should want. I mean, I've had patients that said, well, thank you. Okay. You take care. And keep in touch, okay?
God bless.
Thank you. You take care.
Thank you.
Okay.
Nice to meet you, Christine. Nice to meet you.
Nice to meet you. Bye.
Yeah. Bye. This is great. I hope people listen. I mean, there is nothing else out there that can do this. And it's so logical, so simple. You read our, like she said, read our website, and it's there. All the science behind is there.